actually never given a presentation like this before. Typically, we serve 80 people, and I've got about 30 people on staff. So I have some talking points that I typically go over with my staff. So I think that's just what I'm going to use here. I want this to be a discussion. I want you to ask a lot of questions. I want you to be very curious. I most certainly am not an expert. I'm learning every day from the individuals I serve, from my staff, from the community. So, you may have something to teach me tonight, but what I do want to talk about, the three ways I want to talk about is through experience, my own personal experience in the profession, as well as family members I have who have disabilities. Through my education, I do have a master's in mental health counseling, and just through love, because we're all in this room because we want to do something bigger and better, right? We wouldn't be sitting here if we didn't want to learn and just make our community better. So, I've been, sorry, I'm nervous. I've been doing this work for about 11 years now. I started in high school. I did an internship in a special ed classroom, and I just fell in love with it. And I've done everything from case management to I've done one-on-one applied behavior analysis, which is one-on-one therapy for individuals with autism, to where now I manage a Medicaid waiver day program. So we have individuals who, they're done with high school, so they come to us, maybe they're not ready to do secondary education or work. So we give them a place to work on skill building, relationships, maybe work on vocational skills. And then I also do like in-home respite, so we're just, we're giving families and parents a break. So those are there's obviously a plethora of other things we do, but that's the big part of what I do. And then we also provide ABA services, which is again that one-on-one therapy. So.
And what is ABA?
Applied behavior analysis. Good, ask away, because I'm going to talk like so applied behavior analysis developed, oh my gosh, years and years and years ago, and it's a specialized behavioral therapy for individuals who have autism. So if you ever hear anybody saying they have to go to ABA or they have to go to therapy in ABA, that's what it is. They get one-on-one with a trained registered behavior technician, and they work on basically the big part is transitioning. So we want to decrease what are called maladaptive behaviors, because everything we do is a behavior, right? And if I jump around, that's how it's going to be. So we're just going to deal with it. Everything we do is a behavior, but specifically with ABA, we want to lower those maladaptive behaviors. So, and then I'm going to get into that in a little bit later and talking about the functions of behaviors. But a lot of times, hitting, kicking, biting, screaming, throwing things, those are the ones that we want to see at least diminish. So these individuals are able to maybe go back to school and function in a classroom, get a job, attend a day program, things like that. So ABA is just getting them ready for that next transition in life. So I'm going to kind of go through this. And I want to start off with talking about it's kind of respect in a bubble for this population. And I feel very privileged to be able to share this knowledge to a room full of people who now can take this and share it with other people. So while I'm talking, I don't know if you've noticed, but we as a society, we categorize things. If you just think about the grocery store, everything's categorized, right? Why?
So you can find
Easier to find.
Right, it's easier. So we as humans, our brains just categorize things because it makes things easier for us to understand and process. So when we categorize things, we have to give them labels, right? Dairy, breads, the sweets. Same thing is with diagnoses, autism, Down syndrome, cerebral palsy. We have to categorize things so it makes sense to us. However, sometimes, and you may have used some of these terms, and I'm even guilty of it too, because you don't know what you don't know, right, until you learn about it. So a big thing is using the R word. We don't use that as a society. If you ever hear it, my suggestion is to just correct people. Some people don't know, and they're not trying to be mean or rude. Using the term MR, that is not a term in the field that is used anymore. Asperger's, surprisingly, that's not even a diagnosis anymore, if you were aware of it. Sorry, I'm talking fast, slow me down.
You're doing great.
So yeah, Asperger's, it's actually not even a diagnosis anymore. So what I urge people to do, and when I'm talking to my staff, I really urge them to use the term with, has, or have. I know an individual with autism. I know my aunt has autism. Can you think of why we would say, I know somebody with autism, rather than saying, oh, my friend is autistic?
Gives value to that person.
Right. So we're labeling them. Why? Because that's what our brains do. That's what helps us understand and make things easier. But however, if we put ourselves in someone else's shoes, would we want to be labeled that way? You know, what labels, like just think of your own labels that you have. Mother, grandmother, aunts, teachers, pastors. Those are the labels that we have. So in all fairness, it's not fair for us to label somebody else. However, if it's a mom, a dad, the individual themselves, and that's how they want to self-identify, then that's their choice and their right. So that's one thing I just kind of wanted to start with, since I do get to do this, and I hear it all the time. You know, we're not being rude or mean, we're just learning together. So do you have any questions on that? And as I go through, that's kind of the terminology I'm going to use, and I want you guys to adopt that when you're, you know, sharing what you're learning throughout this whole process.
So the whole Asperger's thing, is that just because now it's just like the spectrum of autism is kind
Yeah.
of what it's, you're just on the spectrum?
Yep.
Okay.
So, and the thing with autism is if any of you know somebody with autism, it is, and they call it a spectrum because it is broad. It is not black and white. Not one person who has autism is going to act the same as the other person who has autism. There may be some similarities, but that's why it is a spectrum. So,
Yeah, we'll hear that phrase a lot. Oh, they're on the spectrum. There's not even the word autism used. You just,
Yeah.
they just say they're on the spectrum, and you go,
well, what
okay,
does that mean?
they must be talking, you know, so.
Yeah, and we know, because again, we go back to categorizing. When someone says on the spectrum, we know, oh, they have an autism diagnosis. So what I like to say is has autism. I also like to use the term, you know, with a disability, has a, you know, developmental disability, physical disability, until I get to know the person and they self-identify, give me the permission to do so as well. So now kind of feeding in to this, starting to talk about language, and the language we use and how powerful our language is. Is that what I want to talk about next? Mm-hmm. Sorry, I might kind of be all over. Yeah, I do want to talk about language and the language we use with these individuals. So for this, I'm specifically just going to stay with autism. I serve a lot of individuals who have dual diagnoses, so maybe autism and Down syndrome, cerebral palsy, just like I said, many other developmental disabilities. But regardless of the disability, the language we use is all going to be the same. It's all going to come from a place of love and respect, because that's how we would want to be treated. So the biggest thing I tell people is the language you use also has to reflect the tone that you're presenting. You can't, you know, say, trying to think of an example. Your body language and your tone just needs to reflect what you're saying. Because we all pick up on body language and we all pick up on tone, as does any other person who has a disability. So with that comes one of the biggest things is patience. Because I think as humans, we get easily frustrated when we don't understand something. Because as humans, we're fixers. And I think everybody in this room is probably a little bit of a fixer, because your interest in doing something like this naturally drives you to fix and to be helpers. So when we can't fix something or we don't understand something, we may be frustrated. So it's okay. It's okay to not know. It's okay to be confused. It's okay to be frustrated. But we also have to know that, you know, do some reflection. Is it the individual making us frustrated, or are we making ourselves frustrated? So sometimes it's okay to stop and step back. I do it all the time. I have to sometimes go to other rooms. I have to take a breath. I have to realize, is it me that's frustrated? And what can I do differently to better support the people I'm working with? So that's just a big thing. Asking for breaks, asking for help, doing things like this where you're gaining more information. I think this is fantastic. A couple things with language, and this is what I train my staff on, is, okay, so what's your role in language? I need to be patient, I need to be kind, I need to use an even tone. But what about it is that I'm saying? We're helpers, right? So we like to help, which involves what? Maybe touching. So, you know, saying, hey, is it okay if I help you? Is it okay if I enter your personal bubble? You know, making sure we're asking questions to these individuals, making sure we're including them in the conversation. A lot of times I have, when our individuals get picked up at the end of the day, we always debrief with the parents and we tell them about their day, what they did. I always call it the sandwich, something good, something challenging, something good. Because days aren't perfect, and that's okay. That's what we're there for, is to help. But I always look, and you know, if the individual's verbal, you tell them about your day. How did you think your day went? How much more empowering is it for them to have a say? Or I will, if they're nonverbal, I will include them in the conversation. You know, John, you can tell, you went bowling, right? Even though he's not saying it, I'm telling his mom about his day through him. I'm including him in the conversation. Yeah, we didn't really want to eat our lunch, but we were through, we ate our tater tots, we didn't eat our hot dog, whatever that is, because again, we're including them in that conversation, which is really important. What questions do you have so far while I take a drink? About language?
It makes sense.
Huh?
It makes
It
sense.
does. Another big one is avoiding talking about people in front of them, right? So again, we're gonna include them. We're not gonna talk about somebody while they're there. We wanna include them in that conversation. And also, using that everyday language. So, if you're not familiar with some of the terminology in the field, that's great. If you are, I try to stray away from that one, especially when I'm talking maybe to a parent or somebody who isn't really familiar, or somebody new, because they're not gonna understand, it's gonna be more confusing. So with language, a lot of individuals who have autism, you might hear, are either verbal or they're nonverbal. So obviously verbal, they can speak. Nonverbal, they don't have the ability to speak. So what are some other ways of communication that, yeah?
No, there are some kids that are considered nonverbal, but they can say words.
Correct. We're correct. So, well, again, I'm trying not to jump around. So we consider individuals to be nonverbal in a professional field where maybe they can say words, but they don't make sense, or it's not functional. So they can't say, I need a drink of water, I need to go to the bathroom. They may just be what's called self-stimulation. I'll get into that in a little bit, where maybe it's a repetitive word that you're hearing, or a repetitive song that you're hearing over and over again, or the same phrase you're hearing over and over again. But it's not something that's functional, that's getting them something they want. So when I say that, and thank you for bringing that up, I'm talking about not being able to make requests verbally. So what are ways, yeah, go ahead. Slow me down.
If they do a combination of like just a few words and gestures, is
Mhm.
that verbal?
Yeah, so it's in
Okay.
there, right?
Yeah.
It just maybe needs some assistance in getting those words out and using them. I have a lot of individuals who will come to me, and the parent will say, oh, they're nonverbal, but they can say juice. I'm like, it's there, it's there. So we just gotta cater to that, and we gotta keep feeding that, and keep working on those skills. So you can't use your voice. How do you communicate?
Sign language.
Sign language, right, absolutely. How else?
Many children that I've worked
Pictures.
with, they have like a word board.
Yes.
So that they're actually communicating with a board, or there's a
Yep.
digital board where they're
Mhm.
actually keying in, so I've seen that before.
Yep. So PECS is the term. It's called Picture Exchange Communication System, PECS for short. And you may see individuals with this, like we have them, they are slung around their back, and it's a Velcro board, and they can open it, it has pictures of everything they would need, so they can pull it off and hand it to a caregiver, a teacher, a parent, to make requests for whatever it is that they desire. There is also electronic, the tablets, the iPads, and I don't know if you've ever seen individuals with those. Usually they're slung around, and they can pull that up, and it's a speaking device, so it actually will speak for them. I always tell my staff, that's their voice and that's their words. It's not a toy for us to play with. It's not something that we get to pick up and carry around. I will grab one and I'll just say like, hey John, you forgot your words, you know what I mean? Because that's their voice. So just like an individual who may have a wheelchair permanently, you think that's part of their person. That's the same thing with any type of communication device or booklet.
So I was thinking as you were talking, and last week the presenter, she made me realize that in our preparation we've got fidget boxes, but I'm wondering if we should begin to put together some communication tools.
Mm-hmm.
And obviously it's going to be driven by the parents, because the parents might want them to use sign language rather than an easier cope, because they're trying to build skills.
And that's something you'll have to explore with the individual. I always say, what is the preferred method of communication?
For the individual?
For the individual.
Or for the caregiver?
For the individual. What is their preferred method? Now if the parents, we're really working on PECs, but they like to point, then obviously that's something you'd work out. Maybe they have a book that they could bring in for you, or needs, we call it a basic needs board. And it wouldn't be a bad idea to have a basic needs board on hand. We have them, that way they're easy to pull out during times of frustration. That has, it's just very simple. Break, stop, drink, yes, no, I think eat, bathroom, I think are kind of the main ones that are on there. You just think of the basic needs. So yeah, that would just be something to ask. What's your preferred method of communication? If you're not familiar with sign language, there's books, there's free apps you can download. I know a little bit to get me by, but again, that's just all part of the learning process. So with communication, there's expressive and receptive skills. So does anyone know what those are? She's like, I'm not gonna say, let someone else answer.
I know Jody does.
So what do you, expressive?
They're going out and then they're coming in.
Yeah, so expressive, it's what we're expressing, it's how we can, it's how do we get our point across? When you express something, how are you communicating? How are you showing that you understand? Yes, eye contact, that back and forth ebb and flow of communication. Receptive, it's how you're receiving something. So this is gonna kind of go into the big part, which is gonna be a lot about behaviors, and I'm gonna kind of give you some tools to keep in your tool belt when you come across some challenging behaviors. A lot of individuals struggle in one or two of the areas. I have a girl who, her receptive, she understands everything. I could tell her, I don't know what's in there, but go in that closet, get me 5 pieces of paper, 2 pens, and bring it back out. And she boop, 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 go in there and get it. Expressively though, she doesn't talk. Unfortunately, she was never taught how to use pictures to communicate. So she will bite her wrists a lot when she's frustrated. So those are the expressive skills that she's lacking. It could be the total opposite. You could have an individual who's able to communicate with you, tell you their wants and needs, but when you talk to them, it's just, in one ear out the other, so it seems to us. So what happens and what interferes is behaviors. And I know when I talked about behaviors before, I talked about, you think of hitting, biting, spitting, things like that. But in the autism world, I always like to say everybody eats. So that's an acronym you can think of. E is for escape. A is for attention. I'm going fast. You're writing them. I love you guys are writing it down. That's great. T is for tangible, and S is for sensory. sensory, I know that's the last letter, but I'm gonna start with that first. In language and in the receptive and expressive communication, you have a lot of interference. We have interference every day. There's somebody out there talking right now. I don't know if you can hear them. You can hear the clicks and clacks, the bathroom flushed earlier. And those are just, you know, everyday sounds and noises that we hear, we're used to. Maybe the TV's on in the background. You know, and I'm not trying to call you out, but like the jingling of purses, things like that. That's all interference we're getting. But because we don't have an autism diagnosis, we're able to process those things. We're able to filter all that noise out. An individual with autism may not be able to do that. The sound of somebody talking may be the only thing that's able to be focused on in that moment. The sound of a flushing toilet may be so loud that it's causing it like really internal pain for somebody. So when we think of sensory, what just stereotypical sensory things, what do you guys think about?
Well, I'm thinking in kids rap, the worship services, like loud.
Loud.
There's lots of
Noise.
kids.
Yes.
You know,
So loud sounds
lots of
and
volume
noises.
and
Yeah.
everything.
Lighting, lights being loud, lights flickering. It's too bright, the light may be too dim.
Somebody might be
Tapping their nails, tapping their foot, kicking the back of a chair.
I think feeling like proximity, like space,
Yeah.
like you're
You're in their
right, too
bubble.
close to me. Yeah.
Yeah. So we even experience that as a neurotypical individual. Like, ooh, this is kind of awkward. Like someone's in my bubble. I don't really like the feeling of that. My pants are too tight. Like, you know what I mean? We're constantly getting this sensory. We can process it. We can manage it. We come up with appropriate ways to cope. So, with sensory comes self-stimulation. So give me some self-stimulations you guys have seen.
Rocking back.
Rocking, yep.
flapping.
Flapping,
Spinning.
spinning,
Echolalia.
echolalia.
Which is the
Go ahead.
repeating of sounds, phrases, or words
Yep.
for self-calming.
Yep. So maybe again, going back to you hear the same, maybe it's the same Dora song. What about visual stimulation?
Yeah.
Rewinding the same
Repeating.
YouTube video, right? Shaking a toy.
Yeah.
Yes. So, what is all of that? Self-stimulation. You said it. What does it do? I think you said it. Yeah. What does it do?
Calms.
It's a
Yeah,
self-soothing.
yeah. It calms you, right? Makes you feel better. We self-stimulate. Think about playing with your hair. You shake your foot. Yeah. Rock back and forth maybe when you get tired. I have a girl at work, she always plays with her earring. That's self-stimulation. So what's different? It's more appropriate, it's more socially acceptable, so for someone to twiddle their ear than to jump up and down, right? So understanding why it's happening, I think, is the first step, right? It's soothing. So when somebody's engaging in self-stimulation, there's a couple reasons for it. It feels good. It's what we call an automatic reinforcement. We get reinforced, you follow a diet, maybe you get a cupcake at the end of the week because you stayed on diet. That's a reinforcement for yours. I didn't spend money all week, but I'm gonna go buy these pair of shoes. That's a reinforcement. When you're self-stimulating, it's automatically happening and it feels good. The other reason is there's something that's bothering an individual and they need to self-soothe. So it's important to understand what it looks like and maybe why it's happening, because then that way we can help. You're plugging your ears, is it too loud? Yeah, go ahead.
I'm having a hard time with somebody biting their wrist, having it be soothing. Like, I would think that that's more of a trying to tell somebody I need help, but that would hurt biting your wrist.
Yeah, it would. So if it's too loud, I'm gonna plug my ears, and I'm trying to communicate it's too loud. So this is a behavior that, again, is a maladaptive one, so that's why we kind of define these behaviors. A lot of individuals, if you're familiar, Pavlov, people don't like to hear it, but it's a real thing. He rung the bell, the dogs drooled, they got the treat, right? That's what behavioral therapy is. It's conditioned, it's learning what the behavior is, and it's learning how do we change it, how do we use reinforcement. So an individual may bite their wrist because they want that phone and they can't have it, and I'm gonna bite my wrist because I'm so mad about it. So what therapy does is it teaches what's called replacement behaviors. So instead of biting their wrist, they're gonna say, man, that's a bummer, I can't have that phone. Or we're gonna sit and wait quietly and calmly for 5 minutes and then you can play on the phone. So it's teaching different strategies to replace that biting behavior. Typically, self-harm usually isn't force sensory. I have a kiddo who he hits himself pretty hard. And it may look like a self-stimulation, but something's really bothering him. People don't like to hurt themselves, if you think about it like that. So there's something going on. So just kind of think of it like that. Is it soothing, or are they communicating something to me? And it may be both. Like, I'm covering my ears because it's soothing to block out the noise, but I'm also trying to communicate it's too loud.
So I'm just gonna interject
Go
really
ahead,
quick.
absolutely.
And this really isn't directly related to what you're saying, but in the application and the process of finding buddies, you may have noticed that we wanted you to commit to a 3 months or a 6 month or a 9 month space at a time. This is why, because it takes a little bit to learn what are the things that are causing this individual to have these behaviors, and what are the strategies that the caregivers are wanting us to utilize. And so if we're switching every week a new buddy, that is not going to help the care providers here, and the individuals will not thrive. So, and we also understand, just a little,
No, go for
that
it.
it's very rewarding working with individuals with special needs, but it's also sometimes exhausting. And so we're wanting to have people feel refreshed and on point and aware, and so that's the reason why we're scheduling that amount of time at a time. So you can re-up and do, you can do 3 months and then off 3 months and on 3 months and off 3 months, but that's kind of that's the rationale behind it. So I just wanted to interject.
No, and I appreciate that, because if you think about just like your friendships in life, you didn't just meet somebody for a week and know everything about them.
Yeah.
Like, it takes time to learn about people. And I don't know, I feel like in this field you get a deeper connection. I have a deeper connection with some of the individuals I work with than I do my own really close friends, because you really get to know them. And a lot of things are communicated non-verbally, so it's just a deeper connection. So yeah, thanks, that's a very good point. And those are things you're gonna learn. Those are things the family, the parents, caregivers are gonna help you understand. It's not gonna be like, here's a person. You're gonna know these things, and they're gonna, we use the term precursors. They're gonna tell you what a precursor is. So before we maybe get to that biting, maybe they're gonna start yelling, and you're gonna be like, oh, that's my sign, something's wrong. I need to be an investigator and figure out what that is. So going back to everybody eats, is it sensory? So we're gonna investigate, is it sensory? I always use the word scan in this field. Scan the room. Are the lights too loud? Is it too? Ooh, they really like pretzels, but they are gluten-free and can't have them. Should I maybe remove them from the room because they're getting frustrated? So you're gonna scan the room. You're gonna look for any of those sensory things. Ooh, Billy doesn't really like Joey sitting next to him, and Joey's getting really close to Billy. I need to probably separate them. So you're gonna be investigators. So that's the S. We'll go back up to the E, escape. Individuals are gonna have behaviors because they wanna escape something. Maybe you told them, hey, we're gonna go stand in line and go to the gym. I'm not standing in line, I'm gonna go over here and do something naughty. And then I'm gonna get to giving you guys some tools on how to deal with situations like that. So, escape, individuals may not wanna do something, or they wanna escape the situation. Again, going back to sensory, it's too loud, it's too noisy. So what is that? The A is access. No, it's not, it's attention. There's 2 acronyms I use these as well. So attention. Do they need attention? Are they getting too much attention? They want your attention, they don't know how to do it, so they're gonna scream across the room. That's not socially appropriate to us, but that's how individuals learn to get attention in the past. So attention. And then T, tangible. You know what a tangible is? An item you can touch or feel. It's a lot of iPads and iPhones, ironically, is not really ironically, but that's what it is. So tangible, somebody wants something they cannot have, typically is what it is. Or they have something they do not want. I don't want this, I'm gonna throw it. So those are typically EATS, the 4 things that are typically gonna cause a behavior. So the behavior, again, it can look like anything from what we use the word non-compliance, which is just not good, doing good listening, to the kicking, screaming, biting, hitting. I mean, you name it. I've seen it, and you might see it too. So we're going to be investigators. So we're going to see typically you want to catch it before it happens, but that doesn't always work, which is fine. So we're gonna be investigators. Okay, this is happening, and this is a pretty quick process because when you're in the moment, it's got to be pretty quick to de-escalate. So we're gonna be investigators. Why is this happening? Everybody eats. Scanning the room. Did I tell them something they don't want to do? Is it too hot in here? What's going on? So we're gonna figure out that's motivation. That's their motivation. Very, very easy one. I'm just gonna use, for example, the room is too loud because that's an easy one, I think. It's really loud in here. Billy doesn't like it when it's loud. I'm pretty sure that's why he's plugging his ears and he's screaming. Okay, so what is my motivation? What does he want? Yeah, he probably wants to leave. So he wants to escape, and it's sensory. So there's 2 right there. So what are we gonna do? How are we gonna help him? You're gonna say, take him out of the room, right? Before that, what are we gonna do?
Turn on music if there's music on.
What if there's other kids in there and they're having a dance party?
ask them
Oh my
what-
gosh, sorry. Give his medicine.
Well, ask them what's wrong.
Ask him what's wrong. Yeah. So you ask him, hey, what's wrong? Okay, but he doesn't tell you what's wrong. Then what? We're advocates. What do advocates do?
Try to get the rest of the kids to quiet down a little bit.
That's not fair to them. They're having a fun dance party.
Maybe say, would you like to leave?
Yeah. There's no wrong answers. There's really no wrong answers. Yeah, we're gonna ask him, hey, do you wanna leave? He's not responding. Billy, you can tell me it's okay. We can leave. It's okay if you wanna leave. He still doesn't respond. Typically you want an individual to tell you what they want, but he doesn't. So we're gonna safely escort out, which I'm not gonna go into that, cause that's what you have somebody coming in to talk about that. So you guys are gonna
to
learn.
reinforce, so go ahead.
Yeah.
I would
It's
say,
okay to tell.
I would say go ahead,
Yeah.
cause it's just gonna reinforce, so. if
Right.
you're
Because we might have different people that night than that have been here, so they may not
Oh,
even be
okay,
here.
so yeah, so we're gonna
Yeah.
safely escort him out. I won't go into like that part, if he refuses. Obviously, worst case scenario, yes, you are gonna remove everybody else, or you're gonna turn the music down. But ideally, you wanna go up and you wanna, offered a choice. Hey, do you wanna leave? Do you wanna stay here? That's a big one, offering choices, cause when we have choices, we feel in control,
Sure.
right?
Yeah.
So we're gonna offer choices. Do you want me to ask them to turn the music down? That's another choice. Yes, jump in.
Well, what about, I'm just thinking about the fidget boxes, cause they'll be in the classroom.
Yeah.
If you find out ahead of time, something that they may like something in that box.
You have it on hand.
And you have it on hand, you can use that to see if,
Yeah.
that may help calm them down.
Yeah, so you offer something that's more reinforcing than what they're doing. Hey, do you wanna go take a break and play on the iPad? I don't know what an example of a box is in there.
Yeah.
There's
Well,
like
there's
toys
nothing.
and tools.
Yeah, maybe there's a toy in there that they're like an actual fidget spinner, or maybe there's a Rubik's Cube, or we call them putting things in that are distracting. Do you wanna sit down and do that instead? So what we're gonna do is we're gonna be advocates, we're gonna offer choices, and you might have to do it more than once. It may not just be like, hey, do you wanna stay or leave? Cause maybe an individual wants to stay, but it's too loud. Oh, these are wonderful. Do you guys get to look at these? Oh, these are great.
As
Yeah,
a
how do you-
teacher,
with my kids, we don't wanna have to turn the music down, or we don't wanna have to ruin the
Yeah.
experience for everybody, so what we do is like, we have like a safe place, a comfortable place, or tools, or like, we've used in the past, like, my friend is sewing vests with rice in them that are heavy, so it feels like a hug. Cause some people like compression or hugs,
So, like,
if they don't want you to touch them, they kinda
Yeah.
still like that, feeling of compression, and
That's great.
so we try everything first.
Yes.
Before we would leave the room, or
That would be your,
do the music.
that would be like worst case, think of it, worst case scenario is, okay, we do have
Yeah.
to, you know, this is getting too escalated, it's out of my control at this point, we need everybody to be safe, so unfortunately, you know. But you're right, using other tools, so you're gonna pull out choices, options, maybe it's, something in here that they really love. A safe space is great to have, I don't know if that's something you have here, that would be wonderful, a place that, you know, maybe is quiet or it is in the corner. Like a weighted blanket or vest, those are wonderful tools as well to have to help
And like,
comfort.
I've noticed like with some of our kids, they pick a person, like a special person, like
Yes,
mine's
like a
couple
buddy.
friends, special person, but my assistant, they, you know, sometimes they like him more, you know, so like, they might want a hug from me, but don't want one from him, or they might want a high five from him, but
Yeah.
don't want one from me, you know, it's just like, it's figuring out that person, like you said, that's why you need that time, because not every, that box might not always work.
No, and it may, 9 times out
Over
of
time,
10,
they might get over
it'll
it.
work. 9
Or,
times out
you
of
know,
10, and then you
so-
have that one time, yeah, you're right.
And they might, you know, want something more. And you gotta, like, I like the word they use, investigate, because you have to investigate every person, every situation. Tomorrow might be different. You know, you can't expect to have the same, you know, same reaction every time.
Right,
You might need to do more, try more, or.
yeah.
Okay, this is just because food is a bad thing for me, because I use it for me. But
Okay.
is food not an option? Like if somebody, it gets calmed down by food, you don't do that? Like at work, they call me the candy pusher because it makes everybody happy, but I myself have issues with it.
Yeah.
But I'm always like, here, have some candy. I used to get mad at my mom for doing that, but I do it to everybody else. So
Well, that would be up to the families, if that's something that they're okay with you doing, is giving away treats. All of these things are what are called reinforcers. You're utilizing a tool, whether it's offering choices, options, toys, a hug, a high five, a blanket, an electronic. You're utilizing these tools. A lot of times people think it's like bribery, but it's not. You're utilizing these tools in order to get an outcome. I want an individual to sit down and be calm. They want, we'll say, a donut. I've got a plate of donuts sitting out. You want a donut? Okay, well, let's sit down, let's be calm, I'll get you a donut. Typically that's gonna work because it's what they want. It's that T from eats, it's a tangible, it's an edible, it's something they want. I don't know where I was going with that. So we're gonna be investigators. Another term I want you to use is called the ABC. It's really easy. And in this field, and if you ever get into this field, you may hear this term. How much time do I have?
You
Yeah,
have
we go
until
until
8:30.
8:30.
Oh, okay.
Yeah,
I'm
Not
gonna
that you
do-
have to go that long, but you have until 8:30.
Okay, I'll wrap it up. Okay, so real quick, we'll talk about ABC. A stands for anesthesia.
Could you spell
Can you
that?
spell that?
There's no quiz. ANTECEDENT. So we're investigators. That A, it's what is happening before this behavior, or what happened to cause this behavior. So you're gonna go back and think of eats. What is it? What's bugging them?
Excuse me.
Yes.
What exactly does that word mean?
An antecedent, it's just, it means before. Like, what is happening before? It's just a fancy
Before
word
the
for
event.
before.
Okay, before
Yeah,
they
before
get-
the event.
Okay, thank you.
Yeah, so what happened before? Be an investigator. That B is for the behavior. What does that behavior look like? I don't know how you're setting this up, but something good I have for all my individuals, I have a sheet that talks about, all the behaviors that could possibly happen, and the antecedents that are probably gonna cause a behavior.
Like a getting to know you form.
Yeah, so like if it's too loud, like, just cause it's an easy one, if it's too loud, Billy's probably gonna plug his ears and scream. So, something like that, that's simple, that way you also know exactly what you're looking for. And then the C is a consequence. And a consequence doesn't have to be a bad thing, it's what's gonna happen after. Could be a good thing. I asked him to sit down, because he wanted a treat, and he did. And that's a good thing. We followed directions. We got what we wanted, and it didn't escalate. So here's just, again, and I don't know, it's so hard because there's so many gray areas, there's so many different situations that can happen. So I'm not gonna use a specific example for this, but this is just something I give everybody as a tool to use if they find themselves in a difficult situation. You're gonna be an investigator, you're gonna find that motivation, so what's going on? You're gonna figure out that function, and you're gonna offer choices. And then if that doesn't work, we're gonna try to lower our demand. Even though maybe you're not saying sit in that chair, just asking what's wrong or what do you want is a demand in itself. So maybe instead of saying that, we're gonna pull two things out we like and show them. Yeah.
So when you say function, you mean going back to your
eats.
eats.
Yeah, like what's going on. Yep. So be that investigator, what's happening.
Can you say that again? That was really great.
What
And
did I
was
say?
trying to
I don't
capture it.
remember.
You said investigate, find the motivation.
Yep, so
and
find the
I think I knew
motivation,
something, and then you said
offer choices, and then you're you lower your demand.
I didn't miss anything.
Cause if you're frustrated and somebody is talking to you and giving you more,
Yeah.
you're not gonna maybe understand or remember or know how to respond, so, you know, do you want that ball or the caterpillar, which one do you want? Okay, well, I may just show them to you, maybe that's just enough to help in that crisis situation.
So, just real fast.
Yeah.
I just wanna say that what you're telling us is if we have individuals who are in a program such as yours or another program where they're getting some behavior modification, these are gonna be the tools that they're using.
Yep, this is what I
Every
teach my
time.
staff.
So it's not that, we're actually reinforcing and we're layering up on what's already happening instead of trying to build something brand new. We're
Yeah.
using the common language for these individuals probably, and then we're using that common language
Yeah.
here. And I really wanna have you drive again. We're not, it's really not the bribery
No.
or it works because it is how we move individuals along for success.
Correct.
It's different than for individuals like me or you. We have different motivations to get us to behave in a way that is appropriate. And so I just want to reinforce that what you're saying is not wrong or mean or inaccurate. It's actually it's a successfully functioning plan.
These
So-
are very basic applied behavior analysis principles that a board certified behavior analysis would come up with this huge treatment plan on how, and a behavior support plan. This is just the building blocks of it. And if you utilize these, most of the time you are gonna be, they're obviously, like I said, just a gray area. There may be times where like, I did all that stuff, it's still not working, that's okay. You're gonna keep trying again. Right, this is frustrating, we have to have patience.
And that's where our communication with the families during our intake process are gonna help the buddies be set up for success, which are planning. We are planning on all that, so if you're gonna be a buddy, that's the plan.
Yeah, and this isn't to scare you. Behaviors, you hear the bad ones, yeah, those are scary, but most of the time they're not scary. It's just, you think of a little toddler crying and screaming and kicking on the floor in the grocery store because they want a toy they can't have. I mean, we've been there, it happens. We're here to advocate, we're here to be helpers, and we're here to help learn, or help teach so individuals can learn.
This is so good, keep going.
Okay, I'm
I
struggling.
think this can really apply to anybody though, like with, like,
I do to my
can
husband
be-
all the time.
I can be bribed.
Just saying with the dishes.
It's like, you know what I mean, it's
Verbal
just
privilege. No, it does.
If you go back to layers, we all, like,
Yep.
and it can be the difference between a boss and a leader.
Give me some
It's gonna be
chocolate.
it, you know.
Well, yeah, and it's behavioral therapy. we all, I mean, think of like watching TV and I see a juicy cheeseburger, man, I'm gonna go out and probably get that juicy cheeseburger, cause I'm conditioned to seeing it, that's a reinforcing photo I've seen. It happens every day, it's just how, our depth of knowledge and then applying it. Again, I'm gonna say it, cause it's good to know and it's good to understand. You think of, what do you do to get your dog to sit? You give them a treat. It's the same thing. It's just for humans. I'm not trying to make that sound bad, but it's worked. It's a scientific, evidence-based therapy. Like I said, you go back, think about weight. Weight loss is a huge one in behavioral therapy. Weight loss, huge. You're constantly getting, like, Weight Watchers, well, they give you the chips. Those are reinforced, I don't know what they are. The little, you know, talk about the coins or whatever.
Yes.
Alcoholics Anonymous does it too. They give weight, it's a reward, right? You're reinforcing yourself for good behavior. Okay, so you're gonna lower your demand or instruction. Maybe you're gonna change the way you're saying something. Maybe it's not being understood. Maybe there's a lot of feedback. Instead of saying, hey, what's wrong, blah, 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 we're saying a long sentence. It's gonna be short and sweet. Some really good statements. If then, such a good statement. If then. If you sit down, we can have a cookie. Oh, I'm sitting down, I want that cookie.
Yeah.
First then is a really good one. You wanna go to the gym? Well, first we need to line up. Right? Cause it's a very clear step. I need to do this in order to get this. It's just breaking things down, it's making them easier to understand. So if then and first then are very, very good statements to use. And I'm not saying if then, like if you don't do that, you know, you don't clean your room. Not that. It's to be able to get that, whatever it is they're needing. And then you're gonna go back. If none of this works, you're gonna go back, you're gonna try again. Maybe, you know, offer different choices. Maybe just, I have an individual who gets frustrated, and he imitates me and takes a deep breath. And sometimes that just helps reset and focuses and centers. Maybe, do you need a break? If you look overwhelmed, do you wanna take a break with me? Do you wanna go sit in our safe spot and take a break together? Do you need help? I see you're getting really frustrated. How can I help you? And then again, going back to the beginning, and in all that time, as frustrating as that might have been, that motivation may have changed. So you're gonna go all the way back and say, well, the music's off, they're still yelling and plugging your ears, now what's wrong? So you're gonna go back and reinvestigate, see if it's the same thing or see if something's changed. So those are just kind of some steps. Just try them. Hopefully you can remember some of them to pull out in those times where it might feel a little challenging and feel a little overwhelming. You know, you're gonna be that role model. You're gonna be a good observer of what's going on, and you're gonna be a good communicator too. So, I mean, I could talk about this forever. I'm not going to. Was there anything I didn't touch on? I know we kind of talked. What questions do you have?
Could you talk a little bit about the importance of transitioning as well?
Okay.
Because in that investigating, you need to know what transitions that child properly.
Okay. So a term we use is called previewing. This is great. That's so important. I missed it. Previewing. Yes, that's a big one. Me coming here tonight, I kind of knew what I was getting into, but you don't really know until you're in the situation. So I'm hot and sweaty and I was anxious, and previewing is going to help decrease all that stuff that's going on. So, we're going to go to the okay, we're going to line up, and I don't know if you guys line up, but I'm just using it as an example. We're going to line up, we're going to walk together, we're going to keep our hands to ourselves so we can go to the gym and have fun. So I just already set up an entire list of expectations for an individual, so they know exactly what it is I'm looking for in order to go do this fun thing. So we're gonna preview, yes.
It's kind of like what they did at sixth grade orientation this year when the kids switched from elementary to middle school.
Okay.
They actually take them to their classes and the bell rings and they go
We're
and
practicing.
they
Yeah.
practice. And
'Cause
it's like the principal says, they're all nervous. They're
Yeah.
all nervous. You're nervous, they're really nervous, and now we're gonna practice, so they
Yeah.
practice.
So yeah, perfect. Think of previewing as practicing. And even though maybe we're not physically practicing it, I'm telling you what's gonna happen. Transitions are very challenging. They're challenging for anybody. Change is hard, change is just difficult. However, it's a part of life. So if we can help by setting up the expectations or explaining what's gonna be happening, that can really help decrease, some challenging behaviors or any anxiety that's happening. So maybe, I don't know, you're gonna try, go ahead. Let's say maybe you're gonna try a new activity. You could show a video, like, hey, this is the activity we're gonna be, that's an excellent form of previewing. We're gonna show a video of it. I don't know, the parachute, look at these kids, they're doing the parachute, we're gonna go to the gym and do the parachute. Gives an idea of, this is what's gonna be happening and coming up next.
So it could be up to the buddy to process with the caregivers or even the person who's giving oversight in this room. We talked about having a base, always having somebody available as a base, and then we have the buddies who are out about. So maybe we need a picture process so they can visually see what's next, depending upon their what
Great idea.
I
These
have
are great
one in the
ideas.
classroom,
You
it's the
said the
whole routine of the
spectrum.
entire
Yes.
day.
Mhm.
So I can
That's
point
a
and say,
great idea.
Yeah,
this
you
is
think
where
about
we're
like a
headed.
bedtime routine.
And then I
I'm
do a
gonna brush
timer.
my teeth.
5
I'm
more
gonna,
minutes,
yeah.
2 more minutes.
Yeah.
All right, friends, Miss Amber said we were going to do this.
And that's an excellent form of previewing. We're gonna go to the gym for 15 minutes. After
That's it.
15 minutes, we're all gonna walk back to the classroom. Okay, guys, we've got 5 minutes and doing a countdown.
Yeah. And sometimes for some kiddos, it's not just the transition. It's what am I going to do when I get in the room? So having a typical routine that you do when you get into the room. We know we're going to, and you have a set routine once you enter a space. So I would assume that we would figure out what the previous steps
Yeah.
were for nonverbal or verbal or lower functioning or higher functioning. So,
Yeah.
and we might be able to brainstorm some ways to set that up by providing a board or providing something in
Or
here as we get going.
Or even a small book.
Yep, that'll be great.
Yeah.
Yeah, I mean, 'cause structure feels good, right? When we know what's gonna happen, ooh, it feels so good. Yeah, that
Yeah,
unknown
makes
is
sense to me.
scary.
Yeah.
Yeah, so yeah, definitely, whether you do a picture board, a book, you show a video, make sure everybody's processing that before. Something else about previewing, I lost it. That was good, thanks for bringing that up. Any other
How do
questions?
let's talk for a second about, we're hoping for as much inclusion as possible. That's the whole point of buddies and not just having a room, but we want inclusion. How would you, do you have steps or ideas on peers in the room with the steps that a buddy is taking with an individual with special needs? How can we blend,
Okay.
like how would you suggest that we set the room up, the peers up, to allow us to be able to utilize some of these skills that you've given us?
Are you talking about like a buddy and or a peer and a peer, or a
Let's
neurotypical
say-
peer with an individual who has autism?
I'm not sure what a neurotypical.
A
Your
neurotypical
phrase
individual
would
is
be.
somebody who doesn't have a developmental
yeah.
disability.
So, let's say, I don't know, I'm not sure who to, anyway, let's say, my Sophia has an adult buddy with her,
Okay.
and she's being, part of inclusion in the
Mhm.
classroom. Is there a way that these two individuals can actually function with the cooperation of the class? Not just within the class isolated, but actually peers
Why am I so
working.
confused by what
I'm
you're
so sorry,
asking
I'm
me?
probably
No,
not
it's
doing a good
okay.
job of
So
explaining.
you're
Can
just
I-
trying to
can I
talk,
s-
you're just talking about
How do I
inclusion
include-
amongst all the kids in general?
How can I get the kids in the
Not the
classroom
buddies.
to be a part of what's happening
Okay.
with the buddy and the,
Okay, so if you think about the buddy, they're like the teacher, they're gonna be the one that's doing, there's another term, we're gonna call it prompting, which is giving instruction. So they're gonna be the one prompting, giving the instruction. Most times, a lot of individuals either have no interest in peers or are interested in maybe the adults. Why? They've been around adults their whole life. Their therapists are adults. They're safe. That's all they know. Kids can be mean and unpredictable. So I would really encourage catering to what the individual is interested in. I think as humans, we're naturally caring and loving for the most part, so especially kids, and I think depending on the age, most younger kids have no idea anybody's even different unless they look different.
Let's say elementary,
Yeah, so,
even upper elementary.
My 3-year-olds don't notice anything about each
Yeah.
other,
Yeah.
just kinda.
yeah, which is a wonderful thing. Yes, go ahead.
You can use books and other tools. Are you talking about helping the other children be aware of what's happening with that child?
Or even being a part of the solution, if there is a behavior that's unwanted, that the kids
Yeah.
can actually understand and
A
know
big-
what's going on.
So you can use books and you can use puppets and other things like that to talk about what's happening, to help them understand what's happening. I have seen that before.
I'm a big, first of all, I don't lie, I'm not good at it. I'm just not. And lying to an individual who asks questions about another individual with special needs, people know when you're lying, you know when somebody's lying, you just know. But I have, the great examples, I have a guy who gets so upset when somebody screams. And he'll go, why are they screaming? And then he gets upset. And for a long time, I was watching staff when I took over this position, just like, oh, don't worry about it, let's go to the other room. Why? So I'll tell him, I said, they're upset. You know how some people yell and they get upset? Well, he's just really mad he can't have a bag of chips right now. And he's just mad about it. So it's just educating. Not being afraid, like, you know, a kid's staring, do you wanna ask some questions? Like, instead of like, look the other way, like in the grocery store, and why? Ask questions, be curious, that's how we're gonna learn, that's how we're gonna have inclusion and understanding and acceptance and love. So I think asking questions, or do you have a question? I think engaging in, we call them preferred activities, so if you have somebody who really likes balls, I would cater to that and have that peer, you know, get in the ball pit with them, bring horses in, I don't know, whatever. Just, you have to be very creative and imaginative, and it's almost like entering that world that they're in. So how do I enter that world? The buddies and as parents, and so you're gonna help those individuals without disabilities enter into the world of that individual who has disabilities. So you just have to, again, be an investigator. What is it they're interested in? And then you're gonna prompt that other kid, hey, we're gonna go do this, because even them, you can say, hey, like, we're all gonna get a snack, but we're all gonna play a game together. So you're gonna kind of even use reinforcement with them. Am I answering it right?
Yeah.
Am I getting there?
Yeah, I think I was going out on a limb to say, hey, can you help us brainstorm how to actually help the entire class be a part of the child's inclusion and not just the buddy?
Yeah.
But you answered it, and I
Okay.
think it's just a matter of us just taking the lead from the buddy and the individual with special needs, and then the atmosphere of the kids, and just working that, so.
Yeah, I think-
You answered it.
Okay,
I have a thought about this.
yeah.
In my daughter's gym class at the YMCA, homeschool gym class, we now have a student with a wheelchair with cerebral palsy. He has an aid. He can walk with his crutches, but he also uses his wheelchair, and he'll switch back and forth. This is new to us. We've had other kids with other kinds of disabilities, but to have an actual physical disability in a gym class is new to us. And I have been very impressed with the way his mom and the aide interact with him, and how the kids at that elementary age just assimilate how everyone else is interacting. Like, he fell down today in gym class on his crutches. And one of the kids, my daughter, one of the other kids went, are you getting tired? Do you want us to bring your wheelchair over? This is very tiring for him to play soccer on crutches.
Yeah.
And
Neat.
they just,
Uh-huh.
it just
Yeah.
became part of,
It's because the adults are, they're modeling the
the
behavior,
adults are modeling the
and the interaction is
behavior.
important.
That's true, cause I take my leads from the caregivers when I'm
Right.
working with an individual that I don't know exactly how to interact. I am totally watching that care provider, and then I model and I do what the care provider is showing me, so.
That's great. I was gonna bring that up, like modeling, like we're modeling behaviors, kids are watching. They're little sponges, so they're gonna model what we're doing and how we're interacting. And I'm not saying normalizing, that's not what I'm saying, cause that's different. Making something seem like, oh, it's nothing. It's just, again, how are we getting into their world? How are we bringing people into our worlds? How are we making our worlds work together? So yeah, modeling's a big one, that's good.
And,
I think overall though too, most kids are just kind. And I think, at least like for our instance with Caden being, he's just been mainstreamed, since he started school, and he's just another kiddo in the class. And so they've been around him enough that they know what his triggers are, they've observed what calms him or what sets him off. And they just acclimate to him because he's just another student. But, they figure him out just as though adults figure each other out.
They're just not so jaded.
Right.
That's awesome.
Yeah, if you think about it, what do we all want? Maslow's hierarchy of needs, if you're familiar with that. What do we want? We want food, we want shelter, and we want belonging and acceptance. That's all we want. That's all any person wants. And if you're acting out of love, and not out of, being hurtful or, selfishness, you're gonna be okay. You are. If your intentions are good. So, what else? Anything else? Anything I missed? Any questions? Yeah.
I think a lot of this could also apply to people who have like mental illness. Like I have an anxiety disorder. My coworkers kind of had to acclimate to that.
Yeah.
They can't jump up behind me in a quiet room or I will scream, like, and things like that. So I think learning these skills are just gonna make you a better person for everybody. Because we all have, like I said before, we can be bribed. We can,
Right.
acclimate. I feel like, we're talking about disabilities, but there are people who live with things that you cannot see too.
Very true. Yeah, I always say, your life is this long, and when you meet somebody, you're only seeing like this much of their life. You don't really know what they've been through, what they're going through, what's going on internally. So all of these skills are great, just to apply here, great, and in your everyday life with interactions with anybody you meet, whether they have a disability or not. Something you can see or not, doesn't matter, so. Anything else you're curious about?
I have a question.
Sure.
For those of us who didn't think to bring tablet to the paper, do you have any of this on paper or some
I
way
can
that we can
condense it and I can email it.
we can
I
have
was
it?
gonna ask you either give me your notes
Yeah.
or well,
I
you
have my
condense it.
entire
Yeah.
30-page training manual. I'm
There
not
you
gonna send
go.
No,
We'll
I'll
take that.
condense it. I'll
And
pull
why
out the
not?
main things
No.
and send it to you. There's a test.
Actually, that sheet that I just gave you
Uh-huh.
had a whole bunch of it on here. The
Similar?
reinforcing and prompting
And if you just
As a
Google,
feature.
we all do Google, right? And you just look up ABA, or if you look up Everybody Eats ABA, if you look up functions of behavior, all this stuff's gonna pop up. It's all the same, but
Yes, in my
yeah, I
mind,
can.
I'm thinking, okay, so we're gonna have some charts, eats charts, and the ABCs charts,
Yeah.
and because I think those are great, like, prompters and cues for us to remember and stay on target, until we learn, I think in the beginning, as we're learning individuals, then it'd be nice to have those little cheat sheets, so, I was already thinking, in their little bags, and on the wall, okay, yeah, that's good.
That's great.
Little binders all
Yeah.
organized.
Little cheat sheet for each individual that goes in their bag, so.
Yeah.
The only thing I was thinking is, I know you have a video you wanna show us, but I was thinking, there are folks in here who might have some really awesome situations that you might be able to help us to actually work through. So anything that you can think of that your kiddos have done that you're like, I wish somebody knew how to handle this.
I have one.
Okay.
So
I
you're
have
gonna
so
solve
many, I have so
so,
many people in front of me.
Amber, she's
She
gonna
said, "I'm
she's
gonna
gonna solve
solve
the problem, you're gonna bring it up.
I'm gonna give you suggestions, maybe,
Yeah,
and I'm not gonna put my name on it.
I have a friend
Okay.
who has SPD and a defiant disorder.
Mhm.
The defiance is sometimes I trigger him because I'm so loud and happy, and I'm like that for the other kids because they enjoy it, but he does not. So he doesn't really enjoy me that much.
Okay.
And it seems like sometimes he loves my assistant, but has a hard time with me because I'm so animated all the time. And I feel like sometimes that brings out some of the, when I ask him to do something, he automatically like doesn't want to, you know, like,
Okay.
or like when he gets aggravated with other people, it brings out the defiance. And so now I kind of just talk to him with a straight, like low voice and like straight face with no emotion, and he responds better to that. But sometimes he doesn't still.
Yeah.
So how do you deal with people with the defiant disorder?
So-
Like how do you help them? Like,
I'm gonna have to ask a couple questions, get
Okay,
more
sure.
information. So you're the like main teacher in the classroom, right? Okay, and is your assistant there all the time?
yeah, he was on vacation for 4 days, and that was
Okay.
not so fun. And I was like, maybe it really is me. You know,
So you found a
this
way
is
to
my first time dealing
communicate.
with ODD, so I've never actually had
How old is he?
3.
Oh, wow.
So
I have,
some of it's typical
sorry, I have to
3-year-old
like take
stuff.
my personal
3-year-old
biases.
yeah.
ODD in kiddos that young is, just from my experience, is just
Cause
I
it's
feel like
more
sometimes it's
typical
like,
in
they're
3-year-old stuff,
difficult.
yeah.
Here's an ODD diagnosis.
Right,
And it's like, well, what's really going on?
sure.
Are you, I mean, and you may know this, but like, I would explore like his home life. I don't know if, how you get information from his morning, but I would.
Very quickly, unfortunately.
Yeah, I don't know if there's a way to do, maybe we do sometimes communication binders or notes back and forth. Cause a lot of times, another term, setting events, we don't know what those setting events are. He could have had a horrible morning, maybe he didn't eat breakfast, he didn't sleep well, they forgot a medication. And all of those things could be factors into maybe why this is happening. And with as young as he is, it's hard, cause it's like,
A lot of things
is
are
this a
typical for 3-year-olds to do.
toddler? Yeah, is this a toddler, is this a typical thing?
I can tell he's just in distress, you know what I mean?
Yeah, something's wrong.
Over like little things, like cause them massive distress, and he just acts out really, aggressively. I don't want, like, I don't
That's
wanna-
okay, yeah,
It's a very aggressive reaction,
yeah.
to just tiny things. So I'm just trying to like manage that when my
Right.
assistant is not.
Well, and it's hard, cause I'm sure you have how many other kids in the
I have
classroom?
16.
Yeah.
Wow.
So how do you, okay, so, well, what have you tried? Let's talk about what you've tried.
Like I said, I've tried not having so much emotion on my face when I talk to him, and I make what I say to him very clear instead of like sarcastic. Well, not sarcastic, but like you know how you say like phrases and that people take them literally. I try not to do that. I try to make everything I say very clear.
Okay.
And then, like if there's a situation where I am being really animated, like singing a song, I give him the safe space. I have like this book corner, and
Okay.
I give him cars and like a little trap
So you can go there.
because he doesn't enjoy all that animated
Okay.
stuff. But like the transitions are probably the hardest part.
Like going to lunch or
Yeah,
another classroom.
even when I go through all the motions of, hey, 5 more minutes, yes, we gotta wash our hands, I don't like soap, no, you don't like soap, nobody likes soap, Miss Amber doesn't like soap, but we'll sing the ABCs together, don't sing the ABCs, I don't like that, okay, I won't sing the ABCs, like, can we just do this so we can eat, cause I know you like to eat, I like to eat, so it's like
Right.
this whole, like, work.
It almost feels like it snowballs a little bit.
And like you said, I don't feel like he has ODD. I feel like some of it's like typical stuff, but it's exaggerated because it's all maybe allowed. You know, like they're afraid to work with him.
And that's so
And
challenging.
I'm not, like I want to work with him, you know,
Yeah.
so.
And it's challenging, my staff get very, very, and I know I'm not like, And I'm not gonna be able to give you a straight answer, because that's a hard situation. Because as teachers, as educators, as therapists, we're only this much of their day,
Yeah.
and we can only do this much. It takes a village, it takes a whole team to be able to support somebody, and if you're doing all you can in this amount of time and it's not happening in the rest of their day or the rest of their week, it's incredibly frustrating, and sometimes you're just like, oh my gosh, I'm done. But we can't do that, cause it doesn't make you feel good,
I mean, like
it's
erase
not your
and
purpose.
start over, like
Yeah,
erase
like a reset
We'll forget
button.
about everything that happened yesterday.
Yeah, from what it sounds like you're trying, you're using all the tools you have.
I didn't think about maybe having a conference, an extra conference, I didn't think about that.
Yeah, I would.
You said communication, it's like, I literally have 30 seconds to say, hey, how you doing, how's it going, alright, I gotta go back to my classroom, there's 15 other kids in here, you know?
Yeah, I would see, there's sometimes where I'll have a kiddo who's just acting just crazy for 2 days. I'm like, what is going on? This isn't normal. And then I'm like, I talk to the parent like, oh, we changed his med. I'm like, oh, okay.
Or they have an ear infection.
But that's okay, cause like, that's our job, right? That's our jobs as therapists, as helpers, as educators, is to get that information. I'm not a parent, but oh my gosh, I couldn't imagine, like, all the things you have to do, not only with the kiddo you're supporting, but, you know, you have dinner and soccer practice, or maybe you have other kids, or, you know, you have, church events that you're doing. So, you know, it's our job to kind of step out of our bubble a little bit to get the information we need. So I would start there, maybe just get some more information on this person or this kiddo. Does he have any other supports? Is he getting any other therapies?
He has an OT.
OT, that might be a great resource to connect with.
I didn't think about trying to connect with that person.
Yeah, I'm having these struggles. Do you see these in OT? Does anything work for you? That collaboration may be good. I'm sorry, I don't have like a clear answer.
That answer is really helpful. I didn't think about a conference, or I don't know if I'm allowed to like contact their OT. You know, I don't know if that's allowed.
I do
I'll
it.
ask my
I
boss.
do it. Usually schools will just be like, no, I can't give you information, but I at least try. That way I know I did everything I could. But it sounds like you're trying. You're pulling those things, offering those choices out. You know, you're giving him a safe place to go. Like, those are all really good things to do. And with some kids, it takes time. And again, you have to go back, and it's frustrating. But just know you're doing everything you can. Just keep that in mind.
Oh, I will do anything to make a child happy.
Yeah,
Anything.
and
You
that's
can have
good.
it.
Your intentions
Yeah.
are good, and your intentions are pure. And you know what? Just sometimes the sad, hard fact of life is, like, I have kids in my daycare, they just don't like me, and I'm like, but you know what? I don't like everybody I meet, right? So it's not fair for me to say all these people need to like me, because that's not how the world is. And so sometimes just accepting that, but then knowing, okay, but I'm gonna still do my best to come in every day and try and teach and love, you know, that can be enough. So, I know, I'm sorry, that's not like a super good answer,
No,
but,
it's fine.
yeah. Oh, sorry.
I was like, why don't you go ahead and show us this video that you
Okay.
can show us on this fidget box?
I love this video, and if you
Extras,
have, kids or even teenagers that you work with, I just think it's cute. But I think it also it's very, it just gives you a really good understanding of autism. And I'll share the link, so if you wanna share it. I started a peer pal program on our ABA side, so I have, neurotypical peers come in and we pair them up with our kiddos, in ABA, and I'll show them this video, cause I think it just helps understand.
Remind me what ABA means.
Applied behavior analysis. I don't know if this is gonna be too loud.
What's that?
I don't know if it's gonna be too loud. Can you hear it louder?
We are all different, and that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye color, and so on. Other differences can't be seen. Our favorite foods, fear, or special skill. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects the senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same world. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We all develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share their views with us. Autism can make amazing things happen.
That's so cute. We can put that on our Facebook page.
Yeah.
And we can actually put it on our Facebook page for the church since we're trying to help people
That's good.
understand. Yes. Thank you.
Yeah, anything else? I'll leave my information if you wanna share it, if anybody has questions they think of later, or you're just mulling this all over, I know it was a lot of information. I love doing this stuff, so just don't hesitate to reach out to me.